Hey folks, it's Dr. Timothy Lineski with LC Rheumatology talking to you today about carpal tunnel syndrome. Driving on the highways of Kentucky, heading to Danville today. So, carpal tunnel is a musculoskeletal disease in which it's pretty simple. You have a nerve that is in your wrist called the median nerve. And when this nerve gets pushed or squeezed on, it will cause numbness and tingling. Now, that numbness and tingling can happen in both hands. And the key, though, is it affects these three fingers. So I can't do this too long because I'm driving. But these three fingers and actually half of this one. So if you're getting numbness and tingling in your thumb and your pointer finger, the probability that this is coming from a squeezing of the median nerve is pretty high. So this squeezing of the median nerve is called carpal tunnel syndrome. Why is it called that? Well, there's this area of the wrist in which there's some ligaments around there that squeeze onto it. Now, one of the keys when you have these symptoms of numbness and tingling in your fingers is what is the cause of that, right? So what is pushing on this nerve? It could be one of a number of things. I'm a rheumatologist, so, for me, I look for swelling in that area. Is this rheumatoid arthritis? Is this, if somebody has a lot of, they're playing a lot of sports and things like this, could this be a tendon issue? But most commonly, this happens to 40 to 60-year-old females more than most people. And it's usually work-related or activity-related. We do a lot of typing and everything. Improper, the way that we kind of hold our bodies at our wrist, and we don't use the proper height for our elbows to be resting on chairs. As a side note, if you're at work and you have to sit all day, if there's an ability for you to stand and even invest in a walking treadmill, they have these on Amazon. They're like about $400. They're expensive, but you could probably get 4 or 5 miles just walking and doing your work. And you think about doing that not just one day, but do that for the whole year. Man, that'll help a couple things. Your low back, help posture and everything else. But that's a whole side note. Otherwise, so we sit around on a computer all day or crocheting or whatever, and that causes some of these symptoms. So you have squeezing of the nerve. Then you say to yourself, well, how do I diagnose that? Number one, it's based on history. But after that, then you're talking about doing what's called a nerve conduction study and EMG. So a nerve conduction study, basically, you see some physical therapy offices do this, PMR doctors, neurologists, and basically they put needles in your arm. And the nerve conduction study basically is touching or stimulating the nerves, and it's trying to see if this median nerve is injured. It's just going to take longer for this nerve to get stimulated or get down your fingers, and that's how they tell if it's damaged. And the second part basically is for your muscles. And if your muscles are affected by this, then when the nerve is touching that area, it'll notice that it doesn't react as well. One of the terrible signs if you see somebody with carpal tunnel is this is called the Thenar Eminence, this area right here of the thumb. And if that is shrinking, then that means that your median nerve is getting squinched. It's not stimulating the that muscle, and it'll atrophy, which basically means shrink. So it's kind of like just lifting weights. If you lift weights, muscles get big. You don't do anything, or if you have a nerve injury like a stroke, your muscles get small. Treatment options, what do you do? Well, number one, fix what you're doing, right? If you're doing the wrong things at work, try to change your how you are, we're getting close, how you are, your work environment. Get your elbows rested, and just Google proper rest for elbows and wrists at work. Don't cock up your wrists like this when you're typing. So that's number one. Number two is, you can take anti-inflammatory medicines or Tylenol. Number three is wearing wrist splints, the ones that have some plastic around them, so that the goal is you wear these at night for 6 weeks, at least probably 4 to 6 weeks. And the goal is that you're not doing this while you sleep. A lot of people sleep like this, and that's the cause of it. So if you have them up like this, now listen, just put them on your nightstand and then put them on and off every night. Don't wear them all the time during the day because you can weaken some of your muscles. But if you put those at night, that helps a lot of people. The thing, if that doesn't work, is we do steroid injections. Now, you have to be careful. You got to do this under ultrasound, but you can give a steroid injection around the median nerve. You have to, not a lot of people do this. Some orthopedic surgeons do, some hand surgeons do, rheumatologists can do it. And then that can last for months. And some people, if you change, you wear the splints, you get a shot, you take some anti-inflammatory medicines, and change your work environment, it may go away. And you never need to have the last thing. And the last thing is this carpal tunnel release, and there you have a surgery. It's a relatively simple surgery for surgeons, because they do some pretty amazing things, but it's kind of tedious, and not all the time does it work. So sometimes you can still grow back, you can still get some compression of that area. So that's kind of the steps that you try to do to help it. A lot of this you can do by yourself, though. Wearing the wrist splints at night for 6 weeks. Talk to your doctor, see if you can take an anti-inflammatory medicine for a few weeks, and then go from there. So really, that's about it when it comes to carpal tunnel. So number one, try to figure out what it is. Number two, make sure it's the diagnosis, and you don't have something else going on that's causing numbness and tingling in your hands. And then number three, we talked about the treatment options. So I hope that helps you all, and I hope you have a great day. Take care.